Good evening, everyone. My name is Fundi Lenyati, otherwise known as Dr. Fundi. Welcome to our 4-year-old Dr. Fundi Digital Health channel, whose sole reason for existence is to facilitate empowering conversations on various issues of public interest within the healthcare continuum and beyond. Today, we are live within this Zoom webinar, but also we are streaming live on YouTube and also on our Facebook pages. We are today hosting the African National Congress, which is the governing party in our country and in also 8 South African provinces. The ANC is the second political party that we are hosting on this platform. On Tuesday, we hosted the Action SA. Before then, we hosted an independent candidate, Anele Mda. So today it is the 10 for the ANC. And why the ANC so early in this series? Well, if you look at the letters of the alphabet, because the name starts with an A, Anele, Action SA, ANC. So that is the answer there, but also the issues of availability. So, that's the reason why we have the ANC today. Now, as the Dr. Fundi channel, we are running this Health Manifesto's webinar series to provide a platform, a platform to political parties and the independent candidates to unpack in more detail what is it that they intend doing, should they be back, in governance. Obviously, I'm talking ANC here. What is it that the ANC is promising the people of South Africa that it will do? So we will cover broadly the manifesto, but the key reason for being here is to unpack the health part of the manifesto. It is an attempt to empower voters in our country to better understand, and have answers to some of the questions that they may have from the various political parties and also from the independent candidates. So the ANC has decided that they will select 3 representatives as panelists, and I will hand over to Dr. Konfi Muluku to actually introduce our guest, starting by introducing himself, and then Dr. Onas Mukari and Barry Michelle. Please unmute, Dr. Muluku.
Good evening, Dr. Fundi and Lizelle, and all the viewers and listeners. What I would just like to say is that, especially to the listeners, is that we had a female panelist who was supposed to be part of us, but because of some urgent matters that arose, the panelists could not come. So that is the reason why you'll see that our delegation is not necessarily engendered. I'm Dr. Confidence Muloko. I'm the coordinator of the ANC-NEC Subcommittee on Education and Health. I'm a medical doctor by profession. I'm the former special advisor to the Minister of Health, former technical support to the late Deputy Minister of Health, and the assistant in the office of the MEC of Health in Gauteng. We are coming from a subcommittee which is not the subcommittee on health, but the subcommittee on education, health, science, and technology. Comrade Barry and Comrade Onas, I would prefer that they introduce themselves. Comrade Barry is a member of the ANC and also a member of NEHAU, and he is in Parliament representing NEHAU. And Comrade Honors is a member of the ANC, and is also the head of the Committee on Health in Gauteng. If Dr. Fundi agrees, if they could just formally introduce themselves. One thing that I did not say is that I'm a former member of FOSAT. FOSAT is a forum of South African Directors General. As I was the head of Department of Health, and also head of Department of Social Services in Mpumalanga in my previous life. Thank you very much.
Thank you. Comrade Perry, maybe you can go first.
Thank you, Dr. Fundi. I would usually say age before beauty, but in any case, thank you very much for this opportunity and for this platform. I think Comrade Confi has given my background. I'm now as parliamentary officer, I also participate and serve at the ANC NEC subcommittee level. And then I'm not sure what other titles to give, but I'm also serving in the Central Committee of the South African Communist Party. That's my credentials.
Yeah. Lovely, lovely. To you, Dr. Honors. Please unmute.
Yeah, sorry about that. Thank you very much, Dr. Fundi. First, we appreciate the platform that you're giving the ANC to come and unpack the manifesto of the ANC in respect of healthcare. My name is Dr. Honors Mukari. I'm a medical doctor by profession and a health economist. I'm here, I'm a member of the PC of the ANC in Gauteng, and I'm the chairperson of the Health Task Team Subcommittee on Health in Gauteng. I'm also a member of the Progressive Professionals Forum, and I'm the convener of National Health Insurance Task Team on behalf of the PPF. Thank you very much.
Thank you very much. Welcome to all of you. So just to give a quick context before we get involved in the questions. So before we had this webinar, I had to prepare, obviously, and I looked at some of the News 24. They've got something that summarizes manifestos there. There's also the Mail and Guardian that has got an area where they summarize the manifestos of the various political parties. So I zoomed in to the one that talks about the ANC. And when I looked at the manifesto of the ANC, I saw that there are 6 priorities, all right, of the manifesto, the broad manifesto. There are 6 priorities: jobs, inclusive economy, tackling of high cost of living, investing in people, defending democracy and advancing freedom, building better Africa and the world. But I was, as a health person, I was looking to see if health is featuring in that top 6, and I didn't see. Maybe let's start there. How did it happen that in the top 6 priorities, the matters of health were hidden? Any of you colleagues can take that question from the ANC?
Dr. Fundi, maybe let me just start there. You did touch on the brief overview of the manifesto. And what I would just like to mention is that people must just remember that the African National Congress is one of the oldest liberation movements, and whose main mission was the liberation of the unity of the Africans and the liberation of Africans. And as it evolved, it focused on the black, especially on blacks and Africans in particular. But it is an organization that is non-racial and non-sexist, and that serves the entire South African population. In its election manifesto, it did not hide the message of health. The manifesto of the African National Congress is very integrated. It has got those 6 priorities, but in those 6 priorities, you will find that there are matters of health that have been infused in almost each of those priorities, including even the last priority, which is a better Africa and a better world, which is the one that drives us to have that international solidarity as the health sector in the African National Congress. I hope that out of those 6 priorities that you have mentioned, you understand why we are saying there was none that was hidden. Thank you.
Lovely. Comrade Perry has got his hand up.
Yes, thanks, Comrade. Thank you. I say, Comrade Doctor. Thank you, Doctor. In actual fact, priority 4 does speak to healthcare. I'm not a fan of this word invest. I think it's too financialized, but it does utilize the word invest in people. And one of the main key points there is to ensure healthcare for all. So it does speak to that. I understand your not complaint, but your perspective on that it should go deeper into it. But as Comrade Confie has mentioned, it is there, and it's mainstreamed, I think, throughout the 6 priorities. Sorry, that was my short and yana input I just wanted to make.
Thank you very much. I was just trying to be provocative there because I did go through deeper in the manifesto, and there is an area that talks about health, which actually has got about 6 key points, and you guys will help by unpacking those. Now, before we get to that, about 2 Sundays ago, it was World Health Day, and the DG of the World Health Organization, Dr. Tedros, gave a message, and his question to the public was, what can the public do to claim their right to healthcare? He went on to say the first thing they need to do is to know their rights in terms of quality health services, rights in terms of education, rights in terms of information. And also within that, understanding the impact of the social determinants of health in terms of access to clean water, air, good nutrition, quality housing, decent work, that is free of violence and discrimination. The second thing he said was standing up for universal health coverage in one's country. And number 3, holding leaders accountable, including mobilizing communities to ensure that right to healthcare is enjoyed by all. Now, in our constitution, section 27, 1A talks about access to quality healthcare for all, including for reproductive health. And B of the same clause talks about the obligations of the state to ensure that everyone has access to quality healthcare. So that is the context of our conversation as we are going to unpack this manifesto of the African National Congress. So I see the hand of Honors Mukari. Doc, you can come in.
No, thank you very much. Thank you very much, Dr. Fundi. My hand was up actually on your previous question, so I will just start there in terms of which priorities that are related to health. I would like to just indicate priority number 3, which speaks about tackling the high cost of living. And I'll just read exactly at that priority number 3, which says that one of the programs that the ANC will do in the next 5 years is to strengthen the health services and implement the national health insurance to make quality healthcare affordable and available to all. And how the national health insurance will tackle the high cost of living is that currently people who do not have medical aid, they pay out of pocket. So that will be a relief to them in terms of tackling the high cost of living. Those that have got medical aid, they are paying high costs, then it will be a relief to them. The implementation of the national health insurance will also be a relief to them in tackling the high cost of living. Thank you very much.
Lovely. Thank you very much, Doc. Maybe there is an area that now focuses on the Health Manifesto itself. There's 6 priorities there: promoting healthy lifestyles, prevention, healthcare interventions or campaigns, moving decisively towards implementing NHI, expanding the ideal clinic program, strengthening financial management and supply chain management in the public health institutions, collaborations on traditional medicines with other countries, leveraging technology and telemedicine. So those are the key points I've picked up. Now, I would like you, any of you, to actually just take us through the thinking first around, these health management, because these are proposed solutions. But maybe the first question is, from where the ANC is viewing things, how would you sum up the current reality of our health system in South Africa today?
Dr. Fundi, I believe we had a caucus before, and this was one of the questions that I was allocated to ask. So I am going to try my best, because it's quite a loaded question and quite broad,
Yes.
and I'm sure my comrades can come in after me if I miss anything. Look, Dr. Fundi, what we're facing obviously is now 30 years into our democratic breakthrough. And whilst we acknowledge many of the massive strides that have been made, whether it's in education, whether it's in health, still a lot more has to be done. We are currently facing, and have been for a number of years, what we characterize as a triple crisis of unemployment, inequality, and poverty, which has now unfortunately manifested into something known as a crisis of social reproduction. This basically means that a working family, an average working family in South Africa, it's become almost impossible to survive, to live, to such an extent that an average working class family in South Africa will run out of disposable income 2 weeks into that month. So half of the month, that family, which usually equates to about 4.5 people in a household, usually led by an African woman, does not have disposable income to make sure that they can survive for the rest of the month. So these are the broader, obviously objective and subjective challenges we're facing as a nation. How does that impact health? Well, we can see in many instances this highly unequal two-tiered health system, which supports majority of which, 60% of the health budget goes towards the private health or the private healthcare sector, which only serves 16% of the population. So in and amongst these inequalities, these massive social challenges that we have, at the basis of it is an unequal healthcare system. And in order to address that, one of the key tasks of the ANC and the current government is to make sure that NHI is implemented, because it speaks to dismantling this highly unequal healthcare system. If I can just give a very brief overview of the healthcare system or the state of health in South Africa. Look, we still have a big proportion of our population that is being diagnosed and treated for HIV/AIDS. Last year, we saw a review that there's increases in levels of hypertension, diabetes, and high blood pressure. Doctor,
Yeah.
I know I'm speaking to an expert, but these are all sicknesses that are indicative of a highly stressful socio-economic situation in South Africa. So as the ANC, as the progressive movements, the trade unions, the South African Communist Party, we've been working on this, and many other progressive people that are probably on this platform. We've been working on this bill for over 20 years now. And I think one of the key issues is not to, how can I say this, bring this chapter back and say, well, look, we want to refresh people's memories about what NHI is. It's been working for a long time now. So I think, just to sum up, the state of our public healthcare sector is in a big challenge. As a trade unionist of Nahawu, I would be ignorant not to admit that. We did site visits during the height of COVID and found that infrastructure in many of our public healthcare systems is collapsing. Many of the vacancies, vital vacancies that need to be filled have not been filled. And also vacancies where it's security, cleaners, etc., are not being filled. This is a basic thing that we need to get right. And obviously it manifests into many challenges that are facing South Africa. So at a public healthcare system level, there's a lot that needs to be done. NHI is going to support that by breaking down this unequal healthcare system. The private healthcare system, as I mentioned, only serves 16% of the population. It's heavily funded. In actual fact, what we found in recent surveys as well is many people are no longer on private medical health insurance. They've reduced that to either hospital plan because it's exorbitant. It's absolutely astounding how much these executives make through the private healthcare system and insurance companies. So this is why, in my final point, and I have to make this emphatic, this is why we're seeing such a backlash, Dr. Fundi, of NHI. Yeah. It's because big capital, big private health insurance companies like Momentum, and I'm not scared to say it, Discovery, even though they might organize a hit on me, these are the ones that are benefiting from it. So they don't want to lose their cash cow, because that's exactly what it is. So NHI speaks to breaking down this highly unequal healthcare system and addresses the basics like infrastructure development, infrastructure maintenance, and obviously ensuring that we fill those vacancies. 40,000 community healthcare workers that risk their lives on a daily basis during COVID, the height of COVID, still have not been fully incorporated into the Department of Health. So these are some of the nuances that we're facing, a society with high levels of inequality and poverty. And we're not saying that this is a golden pill. We know that NHI will be introduced incrementally, but it's a start. And the last point is that this is not some ideological posturing from the ANC, the SSCP, and Trade Union Federation, COSATU. This is the implementation of that section that you are speaking to, section 27, subsection 1 of the Constitution. So it's not an ideological matter. It's the implementation of a principle that people have died and fought over for many, many years to achieve. That's the state, in essence, I would say, of the public. Obviously, we can go in a lot more detail, but just as an overview and as an interest of time, I think that should suffice.
No, that's fine. So, but Dr. Konfi, I actually want to pose a question to you. Dr. Konfi, please unmute. Right. So I think we're looking at the 30 years since 1994. And I think it would be good to also just get a picture of where things were in 1994 with the Republic of South Africa, with the homelands, independent homelands, with the self-governing territories, and all of these having to be put together towards creating a national health system. Can you just remind us a bit about that task? Because we've just heard now from Barry that you've been working on the NHI for the last 20 years. So can you just maybe just give us a bit about that history?
What happened?
Dr. Konfi?
Yeah, something happened and I couldn't see the screen. My apology for that. Yeah,
where are we coming from in 1994 to where we are now in 2024, 30 years later?
The manifesto of the ANC, in fact, is a message to all South Africans, rich and poor, black and white. It asserts exactly what you are asking. The fact that over 30 years of freedom, we have achieved much, but also it highlights in a very honest way that there are certain things that we could have done. If you take a number of steps back, and because you are asking in terms of the NHI, the manifesto of the ANC that we are having here in front of us today, in fact, when you examine it and you look at health, you will find that it has got that characteristic thread That starts from the time when our people were asking for freedom in a very nice way, in the early days of the African National Congress. But what then happened was, through the years, if you look at African claims, 1943, you look at the Freedom Charter, you look at the 1962 Road to South African Freedom, you find that it expresses exactly what you are saying, where we found ourselves being in South Africa, but being regarded as non-people. In 1994, which is just another milestone, by the time that we reached 1994, it was when we have been, as a movement, doing our level best together with our people to get political freedom and economic emancipation. And what kept this organization going, it's mainly two things. That fight for freedom, which is the cause of the ANC. The ANC found that cause is just, and it is the cause of political freedom and economic emancipation. And that led it to have its own political line, which is expressed, in fact, in the Constitution and in the Freedom Charter, which is the political line of a united, non-racial, non-sexist, democratic, and prosperous South Africa. Now, in 1994, when some of us were asked to go to Parliament, some of us refused. We said it's not necessary to go to Parliament. It's far much better if we sit in the kitchen and we work from the background, from the back room.
Yes. Yes.
We had a system that was completely fragmented. You had what they call independent homelands. You had the self-governing states. You had everything. You had the Transvaal, you had the Cape, you had the Free State, where health itself was just fragmented, not only in terms of color or race, but also in terms of class. So we were faced with a mammoth task of building out of those many fragments a system that is unitary, that would serve everybody. That is why in 1992, we came together and we agreed that we were ready to govern. Some people do not know that with the wisdom of the leadership collective that was being led by President Oliver Tambo, there had been in his office a Department of Power Development, which selected young people and old people who were patriotic, and it trained them so that one day when we were free, we would then be able to run this government. That Department of Power Development, it was because of the human resources that we had that we were able to put in place the strategic management teams. And those strategic management teams work together with the Progressive Health Alliance and the people on the ground. And I can say without any fear of contradiction to say, the first term of governance of the African National Congress, even up to today, it was the best term, because we came into government and we came into government determined and we had authority. Now, who was asking a question as to what is it that we are having at this point? And what are the areas of the health system, public and private, that might require to be addressed? I'll try and be very short and say, if you are looking at the cross-cutting problems, you'll find that that fragmentation that we tried to get rid of, we have not been able to go over it, because we still have a two-tier system with lots of people being in the public sector, few people being in the private sector, and even the sectors themselves being fragmented. You also have inadequate distribution of health resources, financial, human, and otherwise. And also, you have got the split between the clinical and non-clinical resources. Now, there are specific characteristics and specific weaknesses, and that informs approaches that affect the public sector on one side and the private sector on the other. When it comes to the public sector, the South African public sector faces several challenges, and those challenges include fragmentation, staff shortages, inadequate and poor infrastructure, financial and cash flow problems. You have got poor information management and even the poor information management technology. Now, to solve that on the side of the public of the public sector, those challenges, the ANC is convinced that the public health system must resolve these problems mentioned above, which includes that fragmentation that you were asking about. But is the private sector perfect? No. The specifics of the private sector is that despite its massive resources, it faces several challenges, and those include inequality and inefficiency, the high cost of healthcare, which are constantly escalating, and also, in many instances, the lack of innovation. And to solve those challenges, the ANC is convinced that the health system must undergo a decisive transformation. I hear many of you talking about reforms. Reforms only produce quantitative change. They do not produce qualitative change. Now the ANC talks transformation, which produces qualitative change, especially by introducing a funding mechanism that will assist the country to attain universal health coverage. And the ANC believes that this will also improve the quality of care of both the private sector and the public sector when we cease to have the two-tier system, but we have got the public sector and the private sector collaborating in one system that is funded centrally. Thank you.
Thank you, Doc. Let me go to Dr. Honors. He's got his hand up. He is a medical doctor and also an economist. Now, it sounds to me from the issues that you've just raised, Dr. Confi, it seems to me that the issue of funding of healthcare is at the center of most of the problems you've mentioned, staff shortages, dilapidating infrastructure, poorly maintained infrastructure, poor maintenance of critical equipment, ICT infrastructure that is lacking in many areas. Now, are you as ANC saying, because you think the central problem is a financial problem, that is where you think when you introduce the National Health Insurance Fund, you will then address all of these problems? So I think the question I'm asking it from Dr. Mkari to say, it sounds from what has been explained by Dr. Moluko that the problem is a finance problem, it's a funding problem of the health system. And you believe that to ensure proper funding, you must come up with the NHI. Am I right in my thinking?
Dr. Fundi, you have captured it correctly. Perhaps to start in your earlier question about from 1994 and where we are, it's important just to know that before 1994, access to quality healthcare was based on race. But beyond 1994, that segregation in terms of access to quality healthcare continued until today. But today is no longer based on race, but it is based on affordability. And this is what National Health Insurance needs to address. Dr. Confi is correct when he says that the problem is a funding problem. It's not a finance problem, but the problem is the current finance mechanism. There's a difference between a health finance mechanism and a financial problem. It doesn't mean that we just need to pump in money in order to solve the problem, but the mechanism should change. But it's important to understand what is the current funding mechanism of healthcare, which needs to be changed. And it's straightforward. The current mechanism in terms of health care is, number one, when you are sick, you have to have money where you pay from your pocket. Number two, you have to have a medical aid, whereby the medical aid will pay service providers on your behalf, or you can go to a public hospital. So that is the mechanism that we are saying that it has led to the collapse of the current system. But then how will NHI address all that? Address in terms of national health insurance is not going to address the issue directly. It's going to, the main purpose is purchasing of services and paying of these services. It is not going to build hospitals. It's not going to employ healthcare workers, but it is going to enable employment of healthcare workers. It is going to enable building of more hospitals, more health infrastructures, because it will be purchasing and paying for those services from the private and public healthcare service providers. So it's a funding mechanism in which, in the sense that currently those that can afford can pay on their by themselves out of pocket, or pay for their medical aid. But with national health insurance, it will be purchasing and paying for those services on behalf of South Africans, and no other role. The main role for the national health insurance is the funding mechanism, in the case that it will play the role that is now played by medical aid. Medical aid currently, they pay healthcare service providers on behalf of their members. National health insurance will pay healthcare service providers on behalf of everyone who is registered. So that is the difference. And Dr. Muluka is saying it's a funding model. So the reform is about how healthcare service is funded currently and how it will be funded with national health insurance. I hope that clarified the matter. Thank you.
That's fine. Now, somebody who's in the opposition side will say the ANC has had 30 years to actually correct the issues that it found in 1994, and 30 years later, there should be a system that is actually working to address and ensure that everyone has got access to quality healthcare. So my question then is, how do you convince somebody that we will be able to get this thing going, to address these problems? When Dr. Confie was listing the problems in the public health system, one of the glaring things that did not come out is the issue of the quality of leadership, quality of management, issues around corruption, mismanagement, and malfeasance. Now, as just one of the issues. So I don't know who can be able to talk around that to say those issues. Barry, you can come in.
Yeah, I'm sorry if I seem over eager, Doctor. I just wanted to address
No, it's good.
because I think it's important, and I appreciate the historical context that Comrade Confie gave. It's important. I'm 37 this year. I'm still relatively young. So 1994, I was still, and I wasn't in the struggle, but having a historical context and understanding is important. And I say that because the development of this bill, NHI, our constitution, the Freedom Charter, for example, are, how can I say this? They represent a kind of social solidarity, community, or society that we aim to achieve or build, And yes, you're correct. 30 years, we haven't achieved that. We're still building it. But I think at any level, any logical developmental state or country that is developing requires to get two basic tenets of society correct. That is education and healthcare. And the funding issue is, because I'm now caught in a little bit of a difficult position being a Nahal parliamentary officer as well as representing the ANC on this platform, I think we need to have an honest conversation, and this platform is useful for that. And some of the colleagues or the participants who are writing in the Q&A section on your Zoom channel asking, well, are we actually going to see NHI implemented? And my answer to that was indeed what you were speaking to. One is the absence of political will around decisively dealing not only with getting NHI implemented, but also dealing with our current challenges in the public healthcare system. That requires political will and leadership. Now, workers in these institutions mustn't be villainized or demonstratized. You cannot imagine, Dr. Fundi, actually you can, sorry, a doctor, but working 4 shifts without a break burns you out. It causes immense stress on your psychology, on your physical body. To be able to perform your services, whether you're a security guard, cleaner, doctor, whatever it might be, physician, it's impossible almost. Added to that, some of the infrastructure within that hospital is either decaying or it's dilapidated. So these are all issues that I think deal decisively with workers and their psychology and ability to work in a healthy environment, especially because it's the healthcare system. So to answer that quite succinctly of what you were asking in the beginning, I think that this mindset, our mindset must be re-energized and rejuvenated from our perspective of 1994. Now we treat our community members as clients, as participants in this democracy. In actual fact, they must be active participants in it. And that requires a shift of that social solidarity kind of influence in our society that we need to do. So this bill and the funding mechanisms and the issues around it require decisive political will to be dealt with. It also requires National Treasury to come to the fore, because many of these funding issues that you're speaking to are in the hands and in the perspective of National Treasury, and also to speak to the money bill around how NHI is going to be funded. So these are critical issues. 30 years into democracy, we have made massive strides. There's still a lot more to be done, but please let's not villainize or demonstratize the challenges that public healthcare workers are facing also in the industry. Thank you very much, Chair.
Lovely. So the conversations around NHI, they've been there for a long time, but from around 2009 onwards, there was a lot of activity around, the various processes, the green papers, the white papers, and everything up until the bill. That bill was approved by the National Assembly. It was also approved by the NCOP in the latter part of last year. Right now, it is awaiting signature by the president. But on the other hand, it has also polarized, our country, with others very much strongly against it and others in support of it. Others are threatening legal action and all of that. Now, what I want to understand from the ANC point of view, the polarization of the various stakeholders in healthcare versus the obligation of the state to provide access to healthcare through means that are within what is reasonable. So I just want to hear about that. I'm gonna ask Makosini Dlamini to also ask a question thereafter. But for now, I just want us to look at the bill has now been approved at all levels, awaiting the signature of the president. But many people are very opposed to it. Many vocal people are opposed to it. I'm not sure whether it's the majority or the minority. And how does the ANC look at this polarization? And is there a possibility that some of the issues that are being raised can be renegotiated to ensure that there's more people, who are behind this radical, form of funding that hopefully should address the health inequity challenges of the country? Dr. Konfi?
Ndadinyati, thank you much for the wait a bit.
I can't see you, but anyway, you can go ahead. Yeah.
You can see me now.
Yes.
Yeah, I'm saying thank you very much for the question. There are quite a lot of things that have not been discussed very openly and very publicly about what you are calling the polarization of society around the national health insurance. When the ANC and the entire Congress movement started asking questions round about 2005, 2004, 2005, that ever since we had a democratic government in 1994, when one looks at the white paper on the transformation of the health system, one found that in that white paper, and also in the document that was the base of that white paper, which was the Green Book, the 1994 ANC Health Plan, and also the Reconstruction and Development Program. We were talking about social health insurance. As we were talked about social health insurance from the days long before we thought 1994 was going to arrive, when we were discussing within NAMDA. With all the efforts that had been made to try and get the social health insurance going, it was then rediscussed and lots of consultations entered into. And the conference of the ANC of 2007, which took place in Polokwane, decided that health and education must be declared priorities. And it is that conference that then decided that we must implement the national health insurance fully by December 2012. Now, when we started discussing as to how to embark on the lawmaking process around the policy on the NHI, the ANC did its level best to be as inclusive as possible. We had lots of organizations, NGOs, and other people that were far outside of the Congress movement participating in the NHI task team. By around about April 2008, we had realized that there were very serious risks that the national health insurance was going to face. And I can say it now, as we are now, we have got to be very straightforward, that in our analysis of the problems that we were foreseeing, we had the medical aid administrators as one of the greatest risks that was going to be an impediment for us to implement the NHI. Secondly, we identified opposition political parties who would be opposed to the NHI on ideological grounds. The third thing is that we identified the risk of members of the medical aid who would be dissatisfied with the NHI if the package that the NHI would give to the people of South Africa would be less than the package that they had, including the government employees who were in GEMS. And lastly, we identified specific National Treasury top bureaucrats who were opposed to the idea of the NHI. Now, that is where the problem of polarization began. We were very fair, we were very straight, and when we were discussing with people, and especially the medical aid administrators, just to come to the end, you find that you would have about 22,000 people supporting the NHI. Then you have got about 77 organizations who are able to write emails, who have got offices that would then be opposed to the NHI for various reasons. And out of the 77, you'd have 40 who would be totally opposed to the NHI, but at the same time, they would be professing that they support universal health coverage, but they are against the NHI. Now, when we were working in the National Assembly, and the consultations that we had were considered, and the bill was then taken to the National Council of Provinces. A few hours before the select committee of the parliament could finalize the National Health Insurance Bill to send it to the president, a few organizations, two organizations that are very dominant within the business community, wrote a letter and blatantly interfered with the legislative process. In the process, trying to drag the deputy president as the leader of government to try and stop the bill going to the desk of the president. Through a democratic process, that attempt to interfere with an all-inclusive, transparent, and very consultative process, it was not going to be blocked. And that is the reason why when we talk about polarization, we talk about polarization by people who are saying that the national health insurance is going to jeopardize their business. They are not interested in the welfare and in the quality of life that the NHI is going to bring, where it's going to bring everybody, rich and poor, black and white, closer to attainment of universal health coverage and equity within the health sector. Thank you.
Thank you. We've got a hand that has been there for some time from Makosini Lamini, and then also from Dr. Onas. Let me start with Makosini. Makosini, please pose your question.
Thank you, Doc, and thanks to your panelists there. Doc, my sense is that, excuse the pun, this whole NHI comes from a misdiagnosis in the sense that there are two issues. It is access and indeed the financing to healthcare for the majority of South Africans. My take and my view is just to look at what is happening currently from a government perspective and what other initiatives have been done by government that talks to centralizing that have actually have not really added value to society. I'm in the IT sector. In the IT environment, Dr. Fundi, you have an agency of the state, which is the State IT Agency, for example, whose mandate was to procure in bulk and assist all government entities, departments, parastatals, and the likes. That entity, as it has turned out, has really not added value. Actually, a lot of national departments or even provincial departments are looking to actually bypass that entity because it has not added value. If anything, it has actually increased costs of procuring IT services for government, right? But just a simple thing, if you look at electricity provision for us as citizens, government have got a mandate through ESCOM to actually bring electricity to the citizens. And they've failed dismally in that, as you can see in the latest episodes, everybody is being pushed to buy their own solar, right, to power their own households, right? So if you look into the whole NHI, we are now talking about getting government to centralize funding. Yet my view is that if you can have 30% of the population being able to have private medical aid, being able to provide for themselves, then the government is left with 70% of the population, of which they must build hospitals and provide for. So the intervention of a private sector to provide a service is actually lessening the burden on the state. The state at all times should try to minimize the interventions that it takes on behalf of its citizens. If there is people that are providing private security for themselves, for example, it means you don't need a lot of police officers for your citizens. You see that? So that is my ask really to say, what do they see your panelists as a challenge with private sector providing a service to willing citizens that are willing to pay an arm and a leg, by the way, if you can see what it costs to be on a medical aid generally. So the government, in my view, is then left with a smaller pool of the population that they need to manage and provide this service, healthcare in this case, right? So I'm wanting to understand as to where does this thinking that the private sector is actually a drain to the system generally, wherein the government can actually get the mandate to take care of those that cannot afford to be in the medical aid system, for example. That's my question, Doc. Thanks.
I think Dr. Honors, maybe your hand has been up. He is raising issues about why don't you leave those who can afford to run with their private healthcare and those who need the government then be taken care of. But then I'm reminded something that was mentioned by Barry earlier about social solidarity, in the funding of these, what they call cross subsidization and things like that. Because if those who can afford, can run on their own, and then those who can't afford must be taken care of by government, would that not create or worsen the health inequities that we are seeing today? So, Dr. Honors?
Thank you very much, Dr. Fundi. Yeah, indeed, it is the responsibility of the state to ensure that everyone has got the right to quality healthcare. That is informed by Section 27 of the Constitution. So national health insurance is actually in response to that, is in accordance to that constitutional requirement. But not only Section 27 of the Constitution, but also the United Nations Millennium Goal, which requests or needs of each country, not only South Africa, that by the year 2030, every country should have implemented universal health coverage. So national health insurance as a funding mechanism, it's a way of achieving those goals of the United Developmental Goals by 2030. Then coming to the issue of polarizations of a perception of polarization between those that do not want NHI and those that support it. It is important to mention, Dr. Fundi, that there's been a lot of public participation in the processes of the National Health Insurance Bill, from up to where it is today. When in 2019, before it was presented in Parliament, and And even after it was passed by the National Assembly through the National Council of Provinces. So generally, the majority of the people support national health insurance because they know that it will address most of the current challenges that are there, because the challenges that are there are very systemic and structural. And then if you leave them as they are, they cannot be implemented. But it is important also to look at how will national health insurance impact on the private health sector, because the perception is created that the national health insurance will actually nationalize or take over the private health sector, which is not the case. As we indicated, national health insurance is just a payment mechanism to purchase and pay. The difference is that they will purchase and pay from both public and private. But how will impact in the terms of the private sector is that the majority of specialists and doctors currently, 80% actually of specialists and doctors are in the private sector, which services only 16% of the population. Only the 20% of specialists and doctors are in the public sector. And national health insurance is to improve access to those services or those expertise from the private sector. And all the national health insurance is saying is that, okay, private health sector, you will just have to comply with certain norms and standards. Then you will we will purchase your services. But in this case, NHI will purchase services from the private healthcare sector on behalf of everyone, not on behalf of only those that can afford. And when you look at that, it's something that no one in the country can be opposed to, because even those that are accessing those private healthcare services because they've got medical aid, they will continue to do so, but they won't have to pay for those services. The National Health Insurance Fund will then purchase on their behalf. In terms of the public sector, how national health insurance would impact on the public sector. There are challenges in the public health sector, as you've indicated: staffing, lack of medicines, infrastructure. But what national health insurance will do is that there is a requirement. Government has to ensure that those facilities conform to certain norms and standards in order to be accredited to be service providers to the national health insurance. So, and in doing so, those service providers are the ones that will then employ more doctors, employ more service providers, because there will be increased utilization. The difference is that national health insurance will only accredit those that comply with those standards. So there will be benefits both in the private sector and the public sector. Thank you.
Thank you. Shamila Gani, you've got your hand up, and then I'll go back to Barry after that. Please ask your question, Shamila.
Thank you. I've got if I can put it, a statement and a question. If we take it back, right, during the apartheid era, there was hardly any private medical facilities or medical aid, very, very few. And if you see, if you know, people went to government facilities, and obviously payment was made, and therefore the budget. And what we must remember was that, you know, majority of the people didn't have access to some of the government hospitals because of racial segregation. But those funds went into those hospitals, right? Very, very few private medical facilities. And you know, and what had happened was that after private medical aid and private hospitals, most of or majority of the funds from the working class and above the working class then went into private facilities where they're shareholders, and it's based on profits, right, and profiteering. And I wanted to ask, what has happened to the oath that doctors and specialists have taken once they qualify that they will provide a service to anybody that requires medical treatment? What has happened to that? Because the industry is if you can look at it, the private industry is based on profiteering. If you look at medical aids, how much people pay, what they get out of medical aids, private hospitals, the rates, and all of those kind of things. So I can't see, and my question is, why would private hospitals and doctors practicing private be against the NHI, because and the reason would be, it would be greed, profiteering. That is the only reason, because they have to serve shareholders. And most of the times, if you look into it, it's the very medical professionals that are shareholders in these hospitals, and they work with medical aids. And if you also look, majority of our people in South Africa don't have access to private medical hospitals and private medical aids because they can't afford it. So and the question is then, why, if you take the oath and you had decided that you are going to become a doctor, a dentist, or anywhere in the medical field, you take an oath that you will serve anybody. So why would NHI going to benefit majority of South Africans, of our people? Why would you oppose such a thing? Because we will have then, a healthy nation. Because if everybody can be treated on the same level, we will have a healthy nation and a healthy labor force, and it would only benefit our country and not individuals' pockets. So I'm asking, what happened to the oath, right? And what is the real reason why they are opposing this? I've traveled, I've seen the health facilities and or if you want to call it the national health that's provided in a country like Turkey, and it's excellent. It's and majority of the people have access to healthcare and quality healthcare. So
Yes.
if that can be answered, thank you.
All right. I'll ask Barry to also take care of your question. But just before you answer that question, Barry, there's a number of people. I mean, you mentioned the issue of staffing in the healthcare facilities. We've got an aging nursing population. We've got some nurses who are going outside of the country and all of that. But then there is the issue of the nursing colleges that were closed in the early days of ANC rule. So, can you try and answer the question by Shamila? Touch on, from a Nehau perspective now, proper training of nurses, because some of the private institutions that train nurses are not doing a very great job. Now, in the NHI, do you think there's, although it's a funding mechanism, but the issue around training of health professionals, to meet the needs, I thought it's something that needed to be brought in. And the issue of trust deficit, because I think we need to talk about that, the trust deficit that some have around some of the programs that are being run. I mean, during COVID, there was corruption, and some people still have that in their minds, and they are saying, won't this mega SOE actually be a pot, for some people to actually try and use it to enrich themselves? So I asked a lot of questions, but I thought, let me just load all of them to you. Then we can move forward. I just want to ask for indulgence from people who have joined us. This was supposed to be 1 hour, but because we have not yet touched on all of the areas, can we at least agree that we can take it to 7:30, if you don't mind? At 7:30, we will have to close, whatever happens. Thank you very much. And Barry, you can go ahead.
Thank you very much, Doc. And I'm sorry about the quality of my video. I'm not sure what's happened. I think it's not a professional camera like yours. And thank you for the questions. Yours, I can say Comrade Shamila's and Mr. Dlamini's. I think Shamila actually asked and answered the question around this issue of privatization. And I'm not meaning to be disrespectful, but the private sector's sole motivation to exist is profit accumulation. There's no essence or principles in wanting to look after people. It's a similar aspect to what we see in the education system, basic education, with these Kuro schools, how they're completely collapsing, and the quality of education that they're bringing out. They have no humanistic understanding or principles of education, or for that matter, in the private healthcare sector, human beings in South Africa. So their agenda is not to assist this country to develop. We must be completely concerned once our country's, the state's capacity is so degraded that it has to privatize its major functions to implement principles in the Constitution. They're not interested in that. Simple as that. That's why there's such a fight back. And I think both of my comrades on this panel from the ANC have hit on this. It's important to understand the roots of this polarization that's happened. Remember, please, comrades and doctors and guests, that this bill has gone through extensive scrutiny. It's gone through a line-by-line scrutiny and debate at NEDLAC. NEDLAC is comprised of organized labor, business, community, and government, okay? And I think that process took nearly 3-4 years, even longer. It then went to public participation processes where our communities had their voice and their say in it. It went through two presidential health summits, completely endorsed by the very people, Dr. Fundi, that are now writing these letters to the deputy president. So it's hypocrisy on another level, because they obviously, like I mentioned, don't want to see their cash cow stripped of the income that they're generating from our people. So that polarization issue is fundamental. Shamila, to be completely frank, we must be always cognizant and recognize the fact that there is a somewhat neoliberal shift in many of our thinkings, and that's part and parcel of what government is doing. From our perspective of the ANC, we still committed, obviously, to build a developmental state. That means not hollowing out key capacity strengths within the state, but building them stronger and stronger and stronger. So what happened to the oath that doctors took? I can't answer that. But what I can say fundamentally and succinctly is that it's obviously clear as light as day that business has influenced heavily on the implementation and now almost stalling of the NHI. And it's because they're threatened by the fact that this bill, once enacted gradually and incrementally, can help millions and millions of people. It's a basic tenet in any society. We don't want to privatize education. We don't want to privatize healthcare. We want to make sure that we build capacity in it. And this goes to the final point that I want to make, and I'm sure Comrade Konfi and others will come in. Your question, Dr. Fundi, the trust deficit around corruption, around the mass looting of our SOEs over the past 10 years. This is something that must be corrected, it must be adjusted, it must be completely stamped out. When we, as Nahau, visited public hospitals and clinics during the height of COVID, this corruption scandal hit. We were disgusted by it, and we must be disgusted by it, and we must condemn it in every quarter. And I like the fact that Shamila is using international benchmark ideas. Turkey, Cuba, for example, is another example. Many of the deterrents or many of the detractors of our NHI bill point to the so-called failing NHS in England, okay? Remember that the British government vacillates between almost a neoliberal and conservative party on a yearly basis or every electoral cycle. The funding cuts to health and to their NHS is a direct result of what the state of it is in at the moment. So I go back to my original point by saying that if we are to correct ourselves, if we are to present ourselves that we have capacity to fully implement this NHI, we must do so with transparency. We must make sure that our communities, from a grassroots, whether it's at a coastal, rural, wherever it might be in the rural, the urban metros, have a basic understanding of what NHI is so that we can regain that trust deficit. And when there are areas of weaknesses, we must stamp out corruption. We must stamp out misadministration. The last point that you mentioned around nurse training, or it's a funding model, yes, or funding mechanism. But I don't see the Chinese wall between the two of those. If I can clarify on that a little bit, this is the dichotomy that a lot of people present to us. They say, well, is it going to increase capacity? Is it going to help infrastructure? I don't see how we cannot understand that it won't do that. Changing that two-tiered system, serving 16% of the population, will most definitely address those issues. And thankfully, we've got professionals like you that are asking these questions, strengthening the bill once it's implemented, around some of these gray areas that I think we need to point out. That's the last point that I wanted to make, is just this point, is that there mustn't be scaremongering around NHI. It's going to benefit our people that live in dire poverty and face a triple crisis. A basic tenant with an increasing population of 62 million that we have now at the moment, which is majority of them youth. We need to address these issues in a principled way, Dr. Fundi. I'm sorry I got a bit emotional there. I just think some of the points are very, very important.
No, that's fine. So Liesl, I've got Liesl Anthony, who's my colleague here in our company, Proactive Health Solutions. She's a qualified clinical psychologist and special interest, obviously, around issues of mental health, you know, and issues around women's health and all of that. So, Liesl, just think about your question. I'll ask Dr. Confie quickly to say something, but whilst we are just refining your question, and I'm going to ask Dr. Confie to be a bit short. Dr. Confie, an average South African who has not been following all the deliberations up to the adoption, you know, of the NHI. They are only waking up now to the fact that this thing is going to be a reality very soon. How do you reassure them that what they are used to, if they were medical aid members, you know, they will still be able to get quality healthcare in the envisaged new dispensation? You know, because yes, there's a lot of scaremongering, and it is affecting some people. So how do you reassure an average South African that you will be in a better off situation? Obviously, these are the people who have access to medical aid, because those who don't have access, who are dependent on public health care, they are likely to see that things will be better. But I'm focusing more on the ones who see that there could be a reduction in terms of what they are likely to get when they go to a health facility.
Thank you very much, if it's a South African who's on medical aid, just wakes up and finds himself or herself in a situation where he thinks that the benefits are going to be less, I'm going to just remind or say to the person, they must just look at the practical things that are happening with medical aids. There's so many things that are happening with to people who are having medical aid, and one of the things that is most painful is when they run out of benefits. I'll just give you a very simple example. The other day I had an abscess in my gum, and I was referred to a dentist, to a maxillofacial surgeon. And when I phoned and I said, can I come in? How much must I bring? I was told that I must bring 15,000 rand. I went to the vet's oral health clinic. They took my medical aid. I did not pay a cent. And within about 45 minutes, they had sorted out the problem. Now, the problem that I mentioned earlier on of overspacing at times in the private sector, or the ever escalating costs, is what becomes a problem. The second thing is that I would just say to the person, when we started discussing and the foundation of the NHI is reflected in its principles, where health is a right and universal access is the aim. and that health has got to be free at the point of care. Now, I had wanted just to very quickly answer some of the things. For example, you talked about corruption and no one answered.
Yes.
The problem with South Africans is that they have got a tendency to of being very sadomasochist. They self-flagellate so much about corruption, when in fact you have got an explanation in the normal. If you know what they call a Pareto principle, it says that out of 300, you have got this 20%. That will always be going in the opposite direction. And that is the reason why we have got to put laws in place. So we must expect that there's this 20% that is going to be wayward, and we must be able to deal with them and deal with them very, very effectively. Now, the other problem that had been mentioned earlier on of the person who was saying, get people to pay for themselves, the 30%. Why worry about the 30%? I find it to be a political and also an economic oxymoron. You are saying, leave these people who are 30%, they will pay for themselves and take care of the 70%, which basically defeats the aim of the NHI. Because with the NHI, what we are saying with the NHI is that the ANC believes in partnership towards a healthy mixture of private and public service in a unified, accessible, and equitable health system. Now, if you are saying keep this 30% and have the 70%, it means that you are saying we must perpetuate that two-tier system and just keep it the way it is. So those people who are arguing that Section 33 of the Act has got to be kept, in fact, are saying don't do anything, leave the status quo. Now, I'm glad Shamila did ask this question around SOEs. Now, the reason why things were working that way is because SOEs were one system. And the function of the SOEs was to control and to protect the strategic sectors of the economy. Whether it be in transport, in energy, in steel, and whatever, they were working as a unit. The collective ownership of those SOEs meant that the wealth of the nation belongs to the people as the people collectively own those SOEs. So what we have seen happening with ESCOM, what we have seen happening with some of the things that we are talking about, which is privatization, is in fact being done contrary to the policy of the ANC on ownership of SOEs, and where it's the best example of a dichotomy between the ruling party and the government that people are in. If these things were being done the way they were supposed to be done, we would end up with a situation where the public sector takes its place once again, owned commonly by the people, where the standard of everything would be very high. The problem is not necessarily only the problem of funding as such. And that is the reason why we have about 7 points of what the ANC will do in the next 5 years if it gets the mandate to be able to serve and to lead. And that includes strengthening the youth health services, promoting healthy lifestyle, moving decisively towards implementing the NHI, strengthening the health infrastructure, training of personnel. You were talking about why people are not being trained in the nursing colleges. And I would just say, if you scratch your head, you'll remember that since 1994, the ANC has been trying to get government to have the teacher training colleges and the nursing training colleges being reopened. Closure of those colleges did not start in 1994. It started around 1984, 1983 with the apartheid government when it saw that its game was off. But the difficulty that we are having is that even when the politicians tell the bureaucrats in the statutory bodies and in the higher education and training sector in government, you have the bureaucratic tail wagging the political dog, not implementing the policies that the ANC has. That is why we have a situation where these colleges have not been opened, whereas everybody sees that the triangle of skills provision has been vetted. And when I say the triangle of skills provision is vetted, for one engineer, you have got 4 technicians. For every technician, you have got 4 or 16 artisans. And that applies also in health. But unfortunately, in South Africa, you have got a situation where instead of mass producing the technical people like the Germans in the colleges, we are trying to train everybody in the universities that are titrating. That's why you end up with the skills provision that is out of sync with the needs of the industry. Thank you.
Thank you. Liesl, quickly, please pose your question to our guests from the ANC.
I think in the interest of time, Doc, I'm just going to have a reflection and a rhetorical question. I think for me as a female South African, I think I was a little bit disappointed not to have seen health as a key priority, but rather as an infusion in priority 3 and priority 4. And I think, you know, the panel for me has agreed to the fact that the majority of South Africans right now don't have access to quality healthcare. And I think that is what this discussion has led to. So for me, my rhetorical question really is, the ANC identifies as a progressive movement. But I'm wondering and pondering, reflecting on where is the progression for those majority South Africans that are suffering under the triple threat or the triple crisis of unemployment, inequality, and poverty, and specifically those households that are headed by African females. Where is the health progression? Where is the mental health progression? And it's purely a rhetorical question. Thank you.
Brilliant question.
I'll leave it to one of our guests to take that question. And Dademukar, I think take that question from Liesl. She's basically saying there are certain realities and the women in South Africa are carrying a lot of burden. Sometimes they become high risk for certain health challenges based on some of these triple, issues that have been identified. So, as the ANC is looking at implementing this NHI, are they also looking at what can be done better? Remember, the manifesto of the ANC is talking about more, better, and quicker. So what is that can be done more? What is it that can be done better? And what is it that can be done faster to actually improve the lot of women from a women's health and mental health and other issues point of view?
Yeah, thank you very much, Dr. Fundi. In the interest of time, I can see we don't have much time, but I'll just want to highlight in terms of how will NHI impact on the triple challenges that Leslie has alluded to. First, it will be unemployment. We know that we have got an issue, and currently, there's an issue of even unemployed qualified doctors. How NHI will impact in terms of improving the issue of unemployment is that one of the criteria for the accreditation of service healthcare providers is that they will be required to employ a certain minimum number of healthcare professionals, mixed healthcare professionals, be it nurses, doctors, dentists, physiotherapists, and so on. So a 400-bed hospital will have a minimum requirement of employing a certain number of healthcare professionals. In that way, there will be an increased demand for healthcare professionals by service healthcare professionals, not by the National Health Insurance. That's number one. In terms of inequality, indeed, the purpose of National Health Insurance is to ensure equity and equal access for all. And then lastly, what impact will national health insurance on the poor? Currently, you have to have money or resources to be able to access better healthcare. And as we indicated earlier on, is that the purpose of national health insurance is that those services people will be paid for on behalf of users and to protect them from financial risk. But then in terms of those, the middle class, those who are on medical aid, what impact will it have? All it will have is that currently, indeed, middle class or professionals who are on medical aid, they are paying an exorbitant amount of money. National health insurance will come as a relief because its implementation in phases will ensure that they access same service providers in the private health sector, whether it's general practitioners or specialists or hospital admissions, as long as those particular service providers has been accredited. So they will service, they will have access to them, but the difference is that they won't have to pay those exorbitant premiums, but the national health insurance will then pay on their behalf. That is the impact that it will have. Thank you.
Thank you. I think there's just one question I need to pose. I mentioned that there are people who are strongly opposed to the implementation of NHI, which is what the ANC is proposing to solve most of the problems in our public health system. Now, these people are waiting for the president to sign the bill into law. They already have a war chest. So does the ANC have a plan around dealing with these legal challenges? Was what I understand and what I hear is that they will do everything possible to delay the implementation for the next 5 to 10 years. And so when that happens, what will the ANC do? Because they want to use the courts to delay the implementation. Maybe, Piri, you can come in.
Yeah, thanks, Comrade Doctor. Just to maybe also add to Liesel's question, the ANC is not a homogeneous organization. Its character, whether it's progressive or not, is usually contested by its component parts because it's a movement, as you mentioned. So it's important, I think, for progressive professionals like yourselves to assist this movement in some of these nuances that we face, because it's happening so rapidly, on a day-to-day basis. Sorry, Doc, your question about whether we prepared or not for litigious action, we've been discussing this obviously at an ANC, NEC level, and also the trade unions representing the federation have also been discussing this, the possible impacts and how we prepare. So just like the opposition or the deterrence or detractors, sorry, of NHI have been preparing, so have we. And it became obvious very early on when we had passed it first in the NCOP, or sorry, just after the conclusion of the public participation processes, we had seen a flurry, many articles being published, whether it's in Daily Maverick or whatever it might be, and some heavy hitters, some big shots in the industry. So we were obviously aware of that. And when we were sitting line by line, whether it's in the Portfolio Committee on Health, the Presidential Health Summits in NEDLAC, all of these issues that were being raised by business, and then in the Portfolio Committee on Health by the DA, almost replicating exactly what they're saying, we found time to prepare for that. So yeah, we prepared for litigious action, and we understand the words incremental and gradual, but from our perspective, the words that you used earlier, radical bill, it's a little bit dangerous because it's not necessarily, and you can use the word radical because radical is going to the root of an issue. One of our biggest challenges in society in South Africa today is health. And like I said, it's not a golden ticket or silver spoon, whatever you want to call it. It's going to take hard work and people like you, professionals and platforms like this, to find the nuances. I don't know if we can build consensus with business at this stage. We've tried in NEDLAC, they agreed with us. Now they're disagreeing with us. So it's the social compact that we want to build is becoming fractured because people are not willing to negotiate or debate in good faith. You know, they rather use side channels, emails and stuff like that. So in any case, that's the input that I wanted to give. Thank you very much for the opportunity once again, Doctor.
Thank you. So a last word, I think Dr. Conti, in business, as somebody who's in business, we normally talk of an elevator pitch. You know, you meet somebody in an elevator, you want to quickly convince them why they must consider you as a service provider. Elevator pitch for you guys as the ANC. Why should people consider the ANC that it should come back and continue with the work it's been doing, whilst they are also considering other people who are in opposition? So really quick elevator pitch. I've done this even to the Action SA. I asked them to do that. So I'm giving the ANC the opportunity, and I'll be doing it to each of the parties coming.
In that I feel very sorry because Lizelle has not been answered. And there are answers on the issue of mental health and also on women. You see, the ANC recognizes the central role of a community centered approach to mental health, and the involvement of people with lived experiences and their families in the process of care and recovery. And that is the reason why, if you look at the 30 years that the ANC has been there, it has enacted, for example, the Mental Health Act of number 17 of 2002, and has done quite a lot of work and has seen to it that mental health boards and all the other structures that are necessary to be there are there, and mental health has been very seriously prioritized. When it comes to women's health, we have done quite a lot of work, and those people that remember that Eddie Mhlanga, the kind of work that he had done, especially on women's reproductive health, on sexuality education, and a lot of work that has been done on teenage pregnancy, where we have forced the Department of Education, the Department of Social Development, and other departments to work together to see to it that teenage pregnancy is attended to. So I felt that it would be very, very unfair if one does not say to me, Lizelle, that her concerns are our concerns, and those have been prioritized. Now, the ANC holds a very well thought out conviction that it has been, as it is today, and will remain the best servant of the people of South Africa. There are a lot of things that have happened. If you look at where we come from and where we are today, there's a lot that has been done. And it is the ANC that says it believes that most people in South Africa appreciate the good that it has done. And it is very confident that the people will renew its mandate because they know very well that the ANC is very committed to serve. Thank you very much.
Thank you very much. I think we've gone way past our time, but still less than the time that the Action SA took. So Barry, just 30 seconds, round up. Barry, is he still around with us? Okay. Honors, Dr. Mukari, is there any last word you want to
Yeah, just the last
say
word.
to people? Quick.
That's the last word, Dr. Fundi. Just to indicate to your viewers that you know, the African National Congress is not coming up with the national health insurance now that we are going for elections. In 2019, in the manifesto, when you go to the manifesto of the ANC in 2019, it was very clear that in the next 5 years, which is the current 6th term of parliament, the ANC will ensure that the national health insurance goes through the processes of parliament and that it becomes law. It is a promise that the African National Congress has kept, and the bill is now with the president. In the current 2024 ANC manifesto, it is very clear in priority number 3 that in the next 5 years, the African National Congress is going to implement the national health insurance to ensure quality healthcare, accessibility to quality healthcare for all. And it is only when the ANC is voted back in power that the ANC can implement the national health insurance. So voters, as they go to the polls, they must know that it's only the ANC that can implement the national health insurance, because all the other parties are opposed to it. Thank you very much.
Thank you very much. Apologies to everybody. We've taken longer than the initial hour that we had planned, but I hope that the discussions as they continued for another 45 minutes or so were actually value adding. I hope that those people who had questions around the NHI, the thinking behind, and why the ANC thinks it's going to be the panacea for most of the problems in the public health system, they have been able to get clarity. Thank you very much. We appreciate all of you. We appreciate your time. Thank you, Dr. Tulare, even though you were in the background, but I'm acknowledging your presence. And thank you to everybody. May you all go and do the right thing, and exercise your right as a civilian and as a citizen of this country. I'm not going to tell you what you must choose and what must not choose. Your vote is your secret. However, my task is just to give opportunity to as many people to come and share what makes them different and why they should get your vote. So thank you very much, Perry. Thank you, Honors. Thank you, Big Doc. And thank you, Lizel. Thank you, Ionela, in the background. May you all have a good night. Thank you.
Thank you. Thank you. Thank you very much, Doctor. Thank you so much for the opportunity.
All right. Lovely.